Right.
So, Steve, I know you started the Health and Wellbeing Task Force under your presidency. What motivated you to initiate the program and to ask Brad to be a part of it?
Well, there's a few things. I mean, one, began looking at the statistics. We learned that lawyers are addicted twice as much as everyone else, that we're depressed 4 times more often than almost every other occupation, and that we were killing ourselves in alarming numbers. And we also learned about multiple lawyer suicides in Rochester and other communities. We also noticed that our profession was starting to take notice. There was an ABA study with the Betty Ford Foundation to look at instances of substance abuse and depression and anxiety in lawyers. And we also noticed our profession had started to pay attention. When I became president, one of the things I learned about was the Lawyers Concern for Lawyers Committee, which does outstanding work. But what I learned was that their task is solely focused on drug or alcohol abuse. And having been, as a lawyer who represents people with disabilities and disability benefit and other kind of cases, including lawyers, I asked, what do we do for our members that have mental health issues? And the answer was, we don't. And I felt like that was something certainly in the area that we were lacking. We convened a meeting that included the appellate division, the grievance folks, and we asked them, why do lawyers get in trouble? And they said the primary reason they do is because of mental health problems, not because of drug or alcohol problems. And so we convened a task force. I could think of nobody better than my friend and colleague Brad to lead that task force, along with Cheryl Heller, both people that I've known extremely well, both people that I have a tremendous amount of confidence in, and both of whom I knew would do a fantastic job.
You two have been friends for how many years?
15?
At least.
At least.
And do you find yourself relying on each other when you need some assistance and help?
All the time.
Yeah.
No doubt. Yeah. Well, not only are we very good friends, but we also do a lot of work together professionally. So we lean on each other relative to cases. We know each other very well. Our families know each other very well. And as a small firm person, I don't have a lot of people that I can lean on. And Brad is the key guy that I can lean on to make sure that when I'm struggling and having some difficulties, he can help me. And I'd like to, hopefully I share that same role for him.
And you know, we've talked about this concept of figuring out who your one is, who your one person is that you will call when you need help. We can all talk to our spouses or significant others, but sometimes we don't want to do that. And when we get in a bad place, the worst place to be when you're in a bad place is in your own head, right? And but when you're in a bad place, sometimes it's really hard to figure out who would I call, even though you probably have a bunch of choices, but you're kind of stuck. Figuring out ahead of time, now, who's your one that you're going to call, okay? Like, you're my one. We've talked about it, right? And I'm your one,
That's
right?
right.
And not only figuring out who your one is that you're going to call, boom, but also, who's looking at you? Who are you the one for? And if we all can figure that out, we'll be a step ahead.
And that's critical because I've had times where I didn't even realize I was in that bad place.
Mm-hmm.
So I had other people, including you and others, that said, hey, you're not really looking too good. What's going on? And it forced me to think about some things that I had just been ignoring. So I think it's not only who I should reach out to when I know I'm struggling, but who's going to watch me when they can observe me and say, you know what, you're struggling.
Mm-hmm.
And one of the things we talked about too was trying to engage spouses and other people who care about lawyers, because sometimes lawyers just don't recognize that.
They really don't.
I know my wife of 30 plus years now will see things and recognize things for me well before I'm aware of them.
Brad, why did you want to be a part of the program and, in fact, chair?
Well, first of all, my good friend asked me to help out. I'm going to say yes, but most importantly, it's a significant issue. We really need to take care of each other. You know, we're geographically spread out like never before. We're all working more than we did before, where there's less social interaction, and that just leads to all of us being isolated and more stressed out than ever, okay? You know, profit margins are getting tighter and tighter. It's a harder gig than it used to be. And I, like many others, I feel the stress of it, you know, and I think that it's important for us to bring our legal community together, remind ourselves that really we do need to take care of one another, and that's really what got me to want to be involved. It's a very important issue. And a lot of times, honestly, mental health issues, they get overlooked. People don't want to deal with them. There's some people say there's a stigma attached to them. No, you just got to pound through it, all that kind of stuff. And they don't really get dealt with. And I really thought Steve's initiative was a great way to deal with it, and I wanted to be a part of it.
And I think, to your point, I think in many ways we communicate more often than when I practiced early in my career, but we don't talk on the phone, we don't see each other very much. So the emails and which, has the effect of, one, I think sometimes creating some misunderstandings and hostilities, but also it's impersonal. I can't see how you're feeling. I can't look at your tone. I can't get a sense as to whether you're struggling, not electronically at least. And so to your point, I couldn't agree with you more. And I think, the profession of email, the expectation of the service we provide is,
Instantaneous.
right now.
At 11 o'clock at night.
Correct, exactly. And so that has, I think, created more stress for folks and made it more difficult. And so all the more reason to have some of these initiatives and to get that conversation not only started, but to continue it.
Right, exactly.